Hi, we've done a few videos on what to do when you're struggling with a herniated disc and when your back pain is caused by herniated disc. And we've got a lot of questions from people, patients saying, well, actually, how do I know if my back pain is caused by a herniated disc? And that's why we're doing this video. I'm going to give you 5 telltale signs to determine if your back pain is caused by a slipped disc or a herniated disc. Now, these are self-tests. I mean, it's always good to go to see a professional if you're struggling with a bit of back pain and you want to get some help, you want to know what's going on. So by no means is this absolutely complete, but it's a guidance for you. So the first thing is actually age and gender. If you're a man and you're between 20 and 50 years old, you have a higher risk of suffering from a slipped disc and back pain than if you're a woman or you're outside that age category. So that's number one. Number two, what we often see is people are what we call antalgic, which means that they are bent forward or to the side. So say I'm struggling with a slipped disc towards my left, then I would bend forward and move away to the right, away from the painful side. So you're a little bit bent forward and to the side. And this is also a telltale sign of a slipped disc causing your back pain. The third thing is the pain is aggravated by coughing and sneezing. People often go, and then they get a massive back pain because a disc is being pushed out again with the coughing and the sneezing. And the best thing to do for that actually is to support yourself on your upper legs, stick your bum out a little bit, so arch your back a little bit, protect yourself, and then have the cough and the sneeze. And you're really focusing and you're stabilizing that lower spine, and that should help you when with coughing and sneezing when you're suffering from back pain. So again, support yourself on your upper legs and stick your bum out a little bit and stabilize yourself this way when you do the coughing and the sneezing. The fourth sign is it's not black and white, but often what we see is people, when they bend forwards, they get more of a pain, and bending backwards actually doesn't increase the pain as much. It can still increase the pain, the disc can still be pinched, but as a general rule of thumb, bending forwards will cause you more pain compared to coming backwards. And the last thing you do, which is the gold standard, what we call, is the straight leg raise test. And you need a bit of help with this one. And what you do, like from a partner or from anybody else, you lay on your back and say, for your argument's sake, I've got the pain in my right leg, have my leg straight, and someone raises my leg up, foot back, and then normally within this range, you will feel this pain in your lower back, maybe even a pain in your buttocks or down the back of your hamstring, and that's also a sign of a slipped disc. What you can do to aggravate it is to pull your toes towards your nose to see if that makes it any worse, or put your chin on your chest. Again, these are all telltale signs of a back pain caused by a slipped disc. We've done some videos for you when you're struggling with a slipped disc. It's called the 3 best exercises to do when suffering from a slipped disc. It's on Facebook, our Facebook page, Milton and Fornham, and also on our YouTube channel, Milton Chiropractic Clinics. Have a look at that. Use ice. There's a video down ice therapy as well when you're suffering from a back pain. There's do's and don'ts, videos on do's and don'ts when you're struggling with an acute episode of back pain. So have a look at that. Again, this is not bulletproof, and if you're not quite sure, see a professional for this. You can see us, you can see someone else. We generally successful in treating this, and so other people. But yeah, so good luck with this. I hope it helps. Hope to give you a bit of clarity and where your problems come from. And see you soon. Bye for now.